Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to demonstrate how to don and doff personal protective equipment, also known as PPE. Before donning PPE, you want to make sure you select the appropriate personal protective equipment, and this is based on the potential infectious agent that your patient has. Plus, you want to pick the right size of PPE. You want to make sure that you are following the sequence set by your hospital's protocols. In this video, I want to demonstrate just one of the possible sequences you can use to put on PPE. So one of the sequences you can use to put on PPE would be first to put on the gown, followed by the mask or respirator depending on what you're going to use, then the goggles or face shield, and then lastly the gloves. And you will don this PPE before you enter the patient care area. First, perform hand hygiene. Then put the gown on by sliding it up the arms and insert the thumbs into the thumb inserts of the gown if present. This particular gown has a loop that can be placed over your head. Then secure the gown by tying the ties in the back. Next, don a face mask or respirator. If using a face mask with ear loops, place each loop over the ears, then grasp the nose piece of the mask and bring it to cover the bridge of the nose. Then mold the nose piece of the face mask with the fingertips of both hands by starting at the bridge of the nose and work outward toward the cheekbone. Then grasp the nose piece of the face mask and pull the bottom of the mask under the chin. If using an N95 respirator, hold the respirator in one hand with the front of the respirator touching the inside of your hand. The metal nose piece should rest near the fingertips. Be sure the top and bottom straps of the respirator are hanging down below your hand and are not tangled or twisted. Take the respirator and place it over your nose, mouth, and under the chin. Hold the respirator in place with one hand. Use your free hand to place the straps on your head. It's very important the straps rest on your head and are not overlapping or tangled. First, take the top strap of the respirator and place it just past the top of your head above the ears. Then take the bottom strap of the respirator and place it around the bottom of the head just below the ears, and then make sure the straps are not overlapping or twisted. To ensure a proper seal of the respirator around the nose area, use the fingertips of both hands to bend the metal nose piece around the nose, starting in the center and working your way outward on each side. Now perform a seal test. Place both hands over the respirator. Take a sharp breath in and make sure that the respirator is sealing over the face during this inhalation. Keep both hands on the respirator and breathe out. While breathing out, feel for any air leaking around the nose piece and around the respirator's perimeter. If air is leaking around the nose piece, try rebending the nose piece with both hands and recheck the seal. If air is leaking around the respirator's perimeter, try adjusting the straps and recheck again, making sure the respirator is not being affected by any piercings, facial hair, or glasses, which could prevent a proper seal. If the respirator still leaks after this, you may need a different size or type of respirator. Do not use the respirator if a proper seal has not been obtained. Next, don a face shield or goggles. If using goggles, apply goggles over the eyes. Make sure any straps or bands of the goggles are secured around the head and the goggles fit snugly but comfortably. Then perform hand hygiene again. Lastly, don gloves by pulling each glove over the hand and extending the cuff of the gloves over the sleeves of the gown. Now I'm going to show you one of the possible sequences you can use to doff PPE. One of the sequences you can use to remove PPE would be first removing the gloves, followed by the gown, then the face shield or goggles, then lastly the mask or respirator. When removing the PPE, you will be doing this inside the patient care area. However, if you wore a respirator, the respirator will be removed once you leave the patient care area. First, remove the gloves. Do not touch the outside of the gloves because they are considered contaminated. To remove the gloves, start by taking your non-dominant gloved hand to grab the other glove around the cuff in the wrist area. Do this by using a pinching motion to grab it. Peel this glove off by turning it inside out and wad it into a ball with your gloved hand. Keep it securely in your gloved hand. Then take the index finger of the ungloved hand and slide it carefully under the cuff of the gloved hand and peel the glove off the hand by pushing the index finger forward against the glove. This will turn the glove inside out. Dispose of the gloves. Next, remove the gown. The front of the gown and sleeves are considered contaminated, whereas the ties and the inside of the gown are considered clean. Therefore, avoid touching the front of the gown and sleeves. Carefully untie or break the ties of the gown. Peel off the gown by removing the thumbs from the inserts, if present, and then move the shoulders and arms up through the gown, which helps allow the gown to slide off the body. Then from the inside, with the assistance of the arms, roll the gown away from the body by turning it inside out. Form it into a ball and discard. Then perform hand hygiene. Next, remove the face shield or goggles. Do not touch the outside of the goggles or face shield because they are considered contaminated. If goggles are used, remove the goggles by carefully grasping and lifting the back band of the goggles over the head. Dispose or clean the goggles per facility's protocol. Then remove the mask or respirator. If a mask is worn, the front of the mask is considered contaminated. Therefore, grasp the ear loops of the mask with the fingertips and remove the mask from the face. Discard of the mask per facility's protocol and perform hand hygiene. If a respirator is worn, the doffing procedure is performed outside the patient care area. The front of the respirator is considered contaminated, therefore remove by the straps. Grasp the bottom strap of the mask and lift it over the head. Then grasp the top strap of the mask and lift it over the head. Dispose or reuse the mask per facility's protocol. Then perform hand hygiene. Okay, so that wraps up this video on how to don and doff PPE. And don't forget to check out the other videos in this nursing skills series.